The COVID-19 pandemic continues to spread fear across the globe, and the death toll jumps well past 18,000. Hello, I'm Anand Naidu, and this is The Heat. The deadly coronavirus death and infection numbers keep growing, and several countries across the world fear the worst is still to come.
More than 415,000 cases have now been reported worldwide. The death toll in Italy is approaching 7,000. New York's governor says it's spreading like a bullet train in his state. And India, with a population of 1.3 billion people, is locking down.
Among the worst hit countries is Iran, where the death toll reached almost 2,000 on Tuesday. We begin with journalist Sarbas Nazari, who joins us from Tehran.
Well, in the latest daily report, nearly the same pattern in the previous days was repeated. Higher mortality and infection rate, and there's apparently what we see here is that there's no sign on the horizon that Iran is any close to flattening the curve. We know that almost all the provinces have in recent days been reporting new cases, but as of yesterday, the health ministry decided to avoid releasing the breakdown. That was a decision that came against the backdrop of the New Year holidays. Iran is in the middle of those important holidays, and the government has been refusing to lock down the epidemic areas, and this has created fears that people will be tempted to travel around. So that breakdown, the health ministry says if they release it, some people will still be trying to hit the road. And President Rouhani, of course, has been dismissing all those fears, saying on April 3rd, when the holidays are over, things will be normal. But many are casting doubts that this is not something to be wrapped up by then. And even if schools are officially reopened, I know families who will be still fearful, and they will not be sending back their kids to school.
Sarbas, what is the situation there in Tehran, where you are right now, in the streets and neighborhoods there?
Well, given the fact that this has always been a booming season for shopping, for people getting together and families visiting each other, against that background, well, the city is relatively empty at the moment. There are many people who are observing the health ministry advised not to go out and stay in their own self-imposed quarantine. But that is not something that could be comprehensive and all-reaching. As long as there's no army-style lockdown on the cities, well, we will still be expecting people to come out and on the street. But overall, generally speaking, the metro stations are entirely empty. There's almost, the public transportation is not used by many people. So, but the situation in the hospitals is very horrifying at the moment. We know that there are thousands being added every day into being admitted into hospitals, and this situation on the ground in the hospitals is very worrisome at the moment, because there is this shortage of supplies, including testing kits and medicines, which Iran has been blaming mostly on Western sanctions, especially sanctions imposed by the United States.
What are the other steps that the government is taking, in addition to the health ministry calling on people to stay at home?
Well, one important step which the government is taking pride in is this nationwide online screening project, which has already covered 38 million people, like more than half of the whole population. And there are some limited restrictions on the roads, when on the entry and exit points when travelers are being checked for their to see if they have any signs like fever. And we know that hundreds of people have been pushed back and sent back inside homes after proving those symptoms. But yeah, these are the key measures which are being taken at the moment. And also all the commercial complexes as of yesterday were entirely closed. That was a very important step that the government took yesterday, but many say that it was too little too late, actually.
What about testing? Does Iran have a sufficient number of testing kits? Are those being distributed around the country?
Well, this has been the most important and challenging issue from day one. At the beginning, there was a huge scarcity regarding that, but as time passed, China was one of the countries that dispatched and sent thousands of those kits to Iran. We have heard a lot about that from Iranian officials. Also, a number of those kits were sent by the World Health Organizations and organization and a few other agencies. But still, it is said from not from official sources, but from medical workers on the ground, that the scarcity is still impeding the containment process and the diagnosis for the new coming patients.
What about the country's broad ability to handle this crisis? Does it have enough hospital beds and, of course, manpower to deal with this?
Well, generally speaking, Iran's medical infrastructure has done relatively good in the past 2 decades, and there has been significant progress in terms of adding the professional staff to that. But as I said before, the key issue has always been the purchase of supplies, which has been hindered due to international sanctions on Iran. Today, the Iranian officials, of course, came out, boasting about having like 20,000 beds, and many of them, they said, are still not used. And this explanation, of course, came in response to questions about why the Iranian government, in fact, excused or kind of expelled the MSF team, a team of 9 doctors who were on the ground to set up a new hospital of 50 beds. The Iranian officials said, well, we have enough, sufficient capability to handle the crisis, and that small hospital would not change much, would not change a lot on the ground. So they decided to in fact, send back the team. And of course, that team has also brought in 2 cargoes of medical supplies, and we don't know exactly if those medical supplies were turned back also, but overall Iran is apparently quite happy with what it has at the moment. And of course, it somehow contradicts the previous calls from the Iranian government to the international community to deliver aid to handle the epidemic.
And Sarbas, what kind of impact is all of this having on the economy of Iran? We know that the economy is already struggling under the impact of sanctions. What will this do?
Of course, yeah. First of all, the timing couldn't be worse, as we discussed before. This epidemic all started 4 weeks before the national holidays, and that is the booming season for all Iranian businesses, both small and big. So many of those businesses, especially travel agencies, will be in the red in the next few weeks, and we will see a lot of those businesses facing a state of bankruptcy. And of course, the other important issue is the recent nosedive in oil prices. Iran's oil income had already been slashed due to U.S. sanctions, and this lower price, this plunge in the income will tremendously affect the Iranian economy. Iran, due to those international sanctions, Iran was already unable to sell its it's oil. Now, given that background, things in the next couple of months will be definitely exacerbating for the Rouhani government.
Sarbas Nazari, thanks so much for joining us, sir. Okay, let's bring in our panel. For more now, we're joined on Skype here in Washington by Negar Mortazavi. She is an Iranian-American journalist. With us too in Washington, D.C. is Eric Ding. He is an epidemiologist at the Harvard Chan School of Public Health. And from Beijing, we're joined by current affairs commentator Einar Tangen. Welcome to all of you to the show. Negar, let me start off with you. As we just heard there, very grim situation in Iran. What are you hearing from family, friends, and colleagues in Iran?
Well, as you said, the situation is grim, and the government is still trying to catch up in the steps they're taking. As it was said, they're refusing to impose a full quarantine and strict measures. And while part of the population has taken this very seriously, I talked to family members who haven't left their homes in weeks. At the same time, there's part of the population that is not taking it as serious as they should. Millions of Iranians were reported to have taken New Year's holidays and basically took to the roads to go wherever they were trying to travel for the tradition of the New Year. And also within the government, there's this much consideration that if they impose strict measures of quarantine, it's going to have a very severe consequence on the economy, already severed by sanctions, as it was said, the economy overall, and also the shortage of medical supplies and medicine, which part of it is, of course, due to the mismanagement of the government inside the country. That has nothing to do with the sanctions, but then an important factor in all of this is U.S. sanctions that have basically strangled the entire economy and limited all kinds of trade, including humanitarian trade.
And Negar, the New Year holiday that you were talking about, is that a time when people actually travel long distances to be with their families? Is this a time when people gather?
Very much. So it's 2 weeks, basically. It starts with the first day of spring in Iran, and 2 weeks that everything is almost shut down in the country. So in that sense, it's actually good that this coincided with the holiday, as many businesses are going to be closed, schools were going to be closed in university. But then at the same time, the tradition is that you take trips, you go see family. Every day you go to a family's house, you take trips to other cities to go see your loved ones. And just the travel part of it is something that very much is in contrast to the measure that is supposed to be imposed by this quarantine. And then also in general, the culture is a very social culture. People are very close, they hug, they kiss, big families go visit each other. And it's just very hard for people to take this as serious as they should.
Eric Ding, let's look at the global picture. The pandemic is spreading. Deaths worldwide are now over 18,000, and infections worldwide are now over 400,000. It's almost 420,000, actually. What is your overall assessment of where we stand right now?
It looks pretty grim. Well, except for South Korea. South Korea, their data looks really, really good, and with really good testing, I trust it. The problem is Europe right now, all these countries, in addition to Italy, Spain is just on the heels of Italy, as well as the UK, Germany, and of course the United States right now. It is looking very, very bad, especially in New York, where the epidemic is soaring in a higher exponential rate than almost every other country in terms of the rate of increase. Where it is now, it's actually faster than where China and Italy were. And Iran were just a few weeks ago. So it's looking pretty grim, but in certain ways, Italy, their containment, their mortality has been down for a few days in terms of decrease in the rate of increase. I think that's also promising that it does pay dividends in 3 or 4 weeks after you put in a lockdown.
So, Eric, how does one explain the fact that in New York, for instance, where the rate of infection is going up, people have been asked to stay at home, to stay off the street, not to gather with other people. Does that mean that people are not heeding these warnings?
Well, for right now, when we're testing a backlog of cases. Cases in which people were getting sick several weeks ago and have not gotten testing up until now when we're finally clearing the backlog. So we're not going to see the immediate effects of the shutdown and the business closings and the school closings until, again, for another 3-4 weeks at the earliest. Right now, what we're seeing is picking up of harvesting of all the cases that have accumulated over the past month when we had limited testing. So I'm still hopeful, but right now the curve is definitely very exponential and very fast.
All right, let's go to China. Let's go to Beijing, to Einar Tangen. And Einar, what's the latest from China? Is the biggest fear right now that there will be infections coming in from abroad?
Yes, you've seen it in the numbers. Basically, there has been no real new cases in China for the last few days, over 5. But the number of cases coming in from abroad increasing more and more. What you have is a lot of returning Chinese, some students, et cetera, and they have been exposed. Beijing, as usual, has a plan. They have been putting in place testing centers so that they don't overwhelm what's happening in Shanghai and Beijing, and basically they're having people go to other areas to wait out their quarantine period. They've set up facilities so that people have a place to go that is secure and safe, and if they're necessary, they can be transferred to hospitals. But let's look at the larger picture. 2 months ago, you had quarantine basically imposed on Wuhan. And now, just 2 months later, you've already seen the epicenter move from China all the way to the United States, according to WHO. And this is pretty fast, pretty frightening, but it also shows a lack of readiness. And I think this is what is really bothering China today, is that you have this patchwork response. Some are adopting this idea of containment, which China pioneered. In this particular case, but others are doing this amelioration, and this is what you see in Iran, where they're just saying, well, we'll just depress the hump a little bit, we'll be half pregnant on this. Unfortunately, that system is not working. You're seeing a lot of countries, especially Great Britain, that initially said we can kind of wade this out, now imposing a containment strategy.
I know there was a fear in China at one point that, once we saw this curve going down, that there could be a second wave. Are those fears still there?
Of course. I mean, there's a real feeling that, the virus has gone abroad, it's coming back. Can it once again establish a toehold? And that possibility is always there. Remember, I mean, China, 80,000 people out of 1.4 billion. That's an incredible statistic in terms of control. But that means that there's a lot of people out there who have not been exposed, and you do not want to reintroduce it. So they're being extremely careful in that regard. But I think there's still this kind of feeling that the future of what happens, especially economically, is going to depend on how the world reacts, not just on a patchwork basis, but hopefully at this G20 meeting that's coming up this week. It's a virtual meeting that the countries that represent 90% of the world's GDP will have some answers and approaches that not only help them, but help the rest of the world, which is in dire need.
Negar, as we heard from our colleague in Iran just a few minutes ago, the situation is being made worse by the fact that the country is facing sanctions, mainly from the United States. Iran has criticized the United States over sanctions, which are causing the Iranians say unnecessary hardship. But the United States Secretary of State, Mike Pompeo, he's been pushing back on that. Let's listen to what he had to say.
There is no sanction on medicines going to Iran. There's no sanctions on humanitarian assistance going into that country. They've got a terrible problem there, and we want that humanitarian medical healthcare assistance to get to the people of Iran.
Senegal, the Iranian foreign minister has also condemned sanctions. What do you know of how they are hurting Iran's ability to fight this virus?
Well, this is something the U.S. administration has been saying, and technically on paper, it's true. There's supposed to be an exemption on medicine, food, humanitarian aid. But in reality, when you talk to people, because at the end of the day, this is a kind of trade. You need to pay for items if you're buying medicine or medical equipment. Any kind of trade or business with Iran has been impacted by financial sanctions. Banks, companies, everyone is afraid of doing any kind of trade with Iran, and that has included medicine and medical supplies. And by the way, not all medical supplies and equipment are exempted from sanction, only medicine is. So in the terms of the kind of supplies, full body gear, ventilators, all of this stuff that is needed in this case, not every single item is exempted from sanction. And even the items that are still impacted by the financial sanctions, this whole burden or this shadow that's been cast on doing any kind of trade with Iran. And then at the same time, we have to recognize how the conservatives or the hawks in Iran, not the entire establishment, but at least part of it, is also pushing back on the U.S. side. We just heard from the reporter and from the Médecins Sans Frontières, the Doctors Without Borders, who sent equipment, they sent crew to Iran to help, and they were invited by the foreign ministry, by the moderate government that's in charge, but powerful conservative forces didn't like them there and basically made them leave Iran and say, we don't need this kind of help from you. So there's a power struggle definitely in Tehran happening. There's also the power struggle happening here in Washington. We've seen Democrats, progressives asking for a relief on sanctions on Iran, but it seems like the Trump administration hasn't given up on that yet.
Eric, getting back to the situation in New York, we saw these figures. We're hearing that the rate of infection is actually doubling every 3 days. What kind of stress is that putting on the healthcare infrastructure in New York, and is it managing to accommodate that stress?
Yeah, New York definitely has hit a potential capacity limit. A lot of hospitals, I'm hearing from colleagues who work there, it is really, really overwhelmed. But at the same time, there are certain hospitals that are less so. But there are pockets in New York in which there is an overwhelming number of cases. And, they're desperately begging for healthcare worker PPEs, personal protective equipment. And I'm hopeful that these doctors will not get sick, because we can try to say we want to flatten the curve as much as we can. But flatten the curve only works if we don't all at the same time keep dropping the healthcare capacity if doctors and nurses start getting sick. And that is the main concern. We need ventilators, yes. We also need protective equipment, and we have to make sure we have testing for these doctors and nurses so that we can immediately take them out of commission and quarantine them if they develop symptoms. These are things that we critically need, and the U.S. is so critically behind. And so when Governor Cuomo says, you can't just tell us, go find your own ventilators. We have to work together as a country to make sure that this epidemic does not become even bigger 50-state epidemics of just like New York.
Eric, you say the U.S. is behind. So what was South Korea able to do, and apparently very successfully, to make the turn?
Yeah, so there's South Korea, everyone heard, they test a lot. But the difference is, one is testing at the frontier of new cases. Whenever someone develops symptoms, they get tested and isolated and trace contact and quarantined out. But right now, the U.S. is not doing that. U.S. is basically testing people once they get severe enough most of the time, other than unless you're a celebrity, severe enough to get into the hospital or have extreme symptoms. And that is the problem. Unless you test at the frontier of new cases just as they develop, you're not going to nip this epidemic in the bud. Testing's important, but we need a test of brand new cases as they emerge so we can stop it in the community. And that's the main difference.
Einar Tangen, China is set to ease the lockdown in Hubei province. What will that mean for the millions of people living there?
Well, let's be clear. They're easing the sanctions, the issues in the province, but the actual city itself will not be ready to open up and be relieved until the 8th of April. And really what this means, it's a reflection of the data. They simply have had no new cases. If that trend continues, then you could expect things to normalize there. They've had a pretty good success after an initial start that was not the best, but they have contained it. Remember, China's done this, and if it continues, China has been able to contain things in about 2.5 months from first recognizing the seriousness of this. Compare that with SARS, which took 6 months. So I think they have shown that they're able to take effective action. The question is, how do you now deal with the economic issues that are out there, and how do you restart this economy? And that's how they're approaching this. They are concerned about reinfections, but they're also concerned about how you normalize the economy.
Yeah, that's the kind of concern we're hearing here in the United States as well. Negar, when it comes to the Iranian healthcare system, I mean, we saw what happened in Italy, where the system was completely overwhelmed. What are your fears of that system in Iran and its ability to handle this?
Well, Iran is a few weeks ahead of Italy. The system has been completely overwhelmed. We hear even a death toll, very concerning death toll among health workers, doctors, and nurses because of partially the overwhelmed system and also this extra shortage or lack of enough equipment. There's been shortage of masks. There's been a shortage of gloves, ventilators, anything you name it. Anything that we're hearing about in Italy right now, we've been hearing about in Iran a couple of weeks before. So that's one issue. Although the country has actually one of the best health systems in the region among its neighbors, we have to remember it's a war-torn region. So if this virus is not contained in Iran and it spills across the borders, which has already some cases across a few countries in the region have been traced back to Iran, in Pakistan, in Afghanistan, Turkey, Iraq. These all have large borders with Iran. The Persian Gulf countries, Arab countries of the Persian Gulf waterways, very close to Iran. A lot of traffic going back and forth across the borders. Some of them have closed their borders, but this is not going to be sustainable for a very long time. So at the end of the day, it has to be contained within Iran. All kinds of help needs to be delivered to the country, and more management by the government, better management and stricter measures, more so that we saw in China on the part of the government needs to be done. And also testing, as the other guest was saying, like in South Korea. The problem with testing, a lack of enough test kits in Iran has also contributed to this issue.
Eric, over the past 2 days, President Trump has been talking about getting people back to work, reopening the economy, as he puts it. Is that a wise idea?
That is definitely not a wise idea right now. What you really need to do to truly suppress the number of cases is to not let up on the brakes. Right now, we put on the brakes of a lot of schools, businesses, and other social interactions. The last thing you want to do right now is to let go of the brakes, just as we're starting to hopefully contain it. And again, it takes about 3 or 4 weeks before we see any effect. Although half the states have not gone really aggressive in their containment whatsoever.
Yeah.
So, but right now for Easter, he's saying Easter.
That's right.
Easter is not going to be enough. I hate to say it, it's not going to be enough end of this month, not enough Easter. And I'm not even sure if end of April is enough, because this epidemic will keep going.
All right, we have to leave it there. Thanks to all of you for being with us. That's it for this edition of The Heat. I'm Arlen Blandu in Washington, D.C. Thanks for being with us.